Our client is a 7-year-old girl that demonstrates voicing of and gliding of R and L. There was nothing remarkable in her medical history. She was evaluated at Kaiser at the age of 6 and presented with voicing of sound and gliding.
In this video, we're going to be talking about minimal pairs. Minimal pairs is a speech therapy technique which involves teaching pairs of words that contain both the error and the target phoneme. It's frequently used with preschoolers, but can also be used with older clients. In this video, we will be demonstrating a type of minimal pairs therapy called minimal opposition.
Here are the steps and stages for minimal pairs with minimal oppositions. Number 1, establish familiarization of vocabulary and contrasted phonemes. Number 2, perceptual training. In this, the clinician needs to establish that the child can hear the difference in the contrasted word pairs. Number 3, production practice activities. This involves activities to elicit a spontaneous or imitative production of the target. Number 4, articulation instruction. If there is difficulty with accurate production, use instructional strategies such as successive approximation shaping, placement cues, models, or metaphor descriptions.
Hi, Gemma.
Hi.
How are you?
I'm good.
Great. So today we're gonna be reading some words off these cards. You remember we did this last week?
Mm-hmm.
Okay, so let's start. Our first word is this one. Can you say it?
Thigh.
Oh, that was really good. I like how you used your th sound. And this word,
Thigh.
thy. That was very good too. So here's our next word.
Bathe.
That was very good. And this one?
Bath.
Okay, do you remember? Put your hand here. Oh, that's great. When you say this word, you're not supposed to feel any vibration in your throat. You turn your voice off. So say it again.
Bath.
That was very good.
Using this approach, the clinician can use behavioral objectives with clear criterions for mastery. As demonstrated earlier, typically 3 to 5 word pairs are used for intervention. Research has suggested that 6 to 10 target words are sufficient to teach contrastive use of the paired phonemes and generalization. This seems efficient. This approach has been around for a while, so there is a relatively robust body of research suggesting that minimal pairs with minimal oppositions are effective. Minimal oppositions are generally used with children with several substitution errors and are most effective for children with consistent substitution errors. However, this approach is effective only with children that have intact cognitive skills, or at least they must have sufficient skills to recognize the confusion created by an error. In order for the therapy to work, the child must be able to detect minimal differences in the word pairs in order for minimal pairs. So as you can see, there is really only a very specific population that can benefit from this approach.
Now we're going to talk about the cycles approach for teaching sounds. The first step of the cycles approach normally would be to review what your client has practiced in the previous therapy session. However, in the interest of time, we're going to skip that and go right to the second step, which is called auditory bombardment. Notice that in auditory bombardment, the clinician does not ask her client to repeat the target or the error sound. Rather, the clinician simply bombards the client with the correct production of the sound for the client to listen to.
Okay, so now that we've had a quick review on our sounds that we talked about last session, I'm going to read a poem that has a bunch of our target sounds. Okay, so I want you to pay attention. You do not have to repeat. This poem is called My Brother's Best Friends. My brother's best friends are his thumbs. They're with him day and night. One of these friends on his left, the others on his right. My brother puts them in his mouth when he wants to rest. And if he's feeling frightened, these two friends are the best. These friends soothe My brother when he's feeling sad.
Did you notice how during the auditory bombardment portion of the cycles approach that the clinician used acoustic highlighting to emphasize sounds that contain the target sound, such as soothe or bathe or thumb? Now we're going to move on to the third step of the cycles approach, and that's play. This time, the clinician is going to ask the client to try to produce the target sound.
You place your hand over your throat. We're going to be feeling the difference between our voiceless, silent sound and our voice vibrating sound, okay? So before we read the whole tongue twister, we're going to split it into parts. Repeat after me. They thankfully think
They thankfully think
this thing is the best thing
this thing is the best thing
that they can throw
that they can throw
3 times.
3 times.
Okay, so let's go ahead and try that again. Let's do they thankfully think.
They thankfully think
Was your voice vibrating a little bit? This thing is the best thing
this thing is the best thing
that they can throw
that they can throw
3 times.
3 times.
Now let's put it together. They thankfully think this thing is the best thing that they can throw 3 times.
They thankfully think that this thing is the best thing that they can throw 3 times.
Now you've had a chance to watch our demonstration of 2 steps of the cycles approach, auditory bombardment and play, in this case a tongue twister, which happened to incorporate not only the target sound, but a contrastive sound which the client could already repeat correctly. The other steps in the cycles approach are to probe, meaning to probe the client for other phonemes which he or she may be having difficulty with and which will need to be worked on in the next session. The final step in the auditory cycles approach is homework, and in this case it might be as simple as something as giving the client's caregiver a list of the words that were worked on in that particular session and asking the caregiver to bombard the client with those words at home for as little as 2 minutes a day and having the client repeat them.
The cycles approach emulates the way that children learn language naturally, gradually, and through extensive auditory input. The approach is specifically beneficial for children with severe to profound speech sound disorders characterized by phonological processes. These children who exhibit extensive omissions, some substitutions, and a restricted use of consonants. For such children who are highly unintelligible, the lack of a criterion for mastery can be an advantage, as they may never achieve 80 or 90% mastery and may have several phonological processes. In the cycles approach, they can all be addressed. Each cycle includes one or more phonological process. There isn't a lot of research supporting the cycles approach effectiveness. It's an intricate therapy approach with many different stages. Even though some research does suggest this method is effective, it is impossible to determine whether all components of the treatment are necessary in order to achieve success. So, which approach would we choose for Gemma's therapy? In her case, since the errors she displays are consistent and she has high intelligibility, out of the 2 approaches described in the video, we would choose minimal pairs. Her speech sound errors consist only of substitutions, and she can clearly discriminate and produce both sounds and has perfect understanding of the semantic confusion caused by an error in the target phoneme. She is not really suitable candidate for classic cycles therapy. As described earlier, she doesn't have an extensive omissions and a restricted use of consonants. In some cases, both approaches may perhaps be suitable for therapy, but in this one, it's pretty clear-cut. Although she has an error that involves phonological pattern of voicing, she only has trouble with one phoneme, and the pattern has already emerged, so she has no need for cycles therapy. The minimal pairs approach will benefit her, highlighting the phonemic and phonetic contrast between pairs of words such as thigh and thy.